Did you get apologies from Firaz then?
Yes, I did. Yeah,
you did. Good. Right. Thank you.
And Victoria.
Yeah, Victoria maternity leave, isn't she? Okay. Thanks. Okay. Right. Let us begin.
I'll start the recording.
Right. Would you welcome everybody? Would you like to let us any other apologies that we haven't just mentioned?
From Paul, Jabara, Firaz, and Victoria.
Okay. Thank you. Any declarations of interest, hospitality, or gifts? No. Me neither. Minutes of the last meeting. Those of you who've looked at them. Any comments for accuracy?
No.
Thank you. Matters arising. Okay, and the action log. There are only two things on there, weren't there? One of which related to a presentation we had at the last governing body, where special arrangements have been made for the vaccination of somebody, I think, who was, or several people perhaps, who were not neurotypical and who needed special support. And I did ask if we could have the access route for that, if any of us came across any. I suppose just at the moment that requirement is in abeyance because COVID vaccination is on the back burner at the moment, but I wouldn't like to lose sight of that. Sorry, Sandy, but I think as Kate's successor, that probably falls on you. If we had a speaker who came, which is not quite the name of the speaker's not in the minutes, who came and did a presentation of what seemed like a very useful service, and I think we ought to know how to access that. Lisa?
I was just going to say, at East yesterday, there was a question raised about specialist support for vaccination with needle-phobic patients.
That's what it was, I think, yes.
Yeah, so Maddie was going to ask Liz Maloney, Sandy, so it's probably easier to wrap it all up in one.
Yeah.
We probably need one comms about any clinics for people that need additional support.
Yep, lovely, thank you.
Okay, thank you.
Thank you. Okay, and the other one, that's Jane. You've just confessed that one, so we'll.
I have just confessed. If
we'll roll that one over. Okay, thank you.
Thank you.
A general update, Ed.
Thank you. I think most issues are captured on the agenda, but just a couple of things to add. I mean, firstly, I'm sure we're all very concerned about the events in the Ukraine, and our thoughts are with everyone involved and impacted upon this terrible conflict. And I'm sure we will do everything we can to, from a health service perspective, to support any refugees that arrive into Suffolk. And I think there will be significant numbers over the next few weeks and months. So I'm sure as a CCG we'll do everything we can to support. Secondly, the CCG has become the first in the country to sign an anti-racism charter with Unison, and that's work that Manda's been taking forward and very important to us as an organisation, as a set of CCGs. And I'm pleased to say that our finance team were recognised at the Healthcare Financial Management Association brackets Eastern Branch Awards, with a particular award for Emily Bosley, who's an incredibly talented individual within Jane's team and has made a big impact, not only in terms of finances, but also in the vaccination effort too. So it was excellent to see Emily recognised. The final thing to say is that we're doing a lot of work around performance and resilience, and also planning. There is a significant amount of work around elective recovery, and all 2-year waits are to be cleared by the end of June, and we're committing to do so. Equally, there's a huge amount of pressure on the recovery of our urgent and emergency care services, and we're seeing significant pressure at the moment as a consequence of the rise in COVID and the sickness as a result of that. So a huge efforts underway. And then the third element to it is around financial planning, and we're NHS is moving from a year where we've had some surplus to where we're now moving towards deficit management. So a big change there and a lot of work on financial planning. Thank you, Chair.
Thank you very much. Any questions for Ed? Okay, thank you. On to strategy and service development. Is there a patient story, Sandy?
No, sadly there isn't, Christopher.
Thank you. In which case, we'll stay with you though and go on to the West Suffolk Alliance update.
Thank you very much. Would you like me to share my screen? Can you see a slide deck?
Not quite yet. Now we can. Thank you.
Thank you very much. Okay, thank you very much. Following Kate Vorton's last update at the governing body on the good progress that's being made around collaborative working across the full range of system partners, we felt this report, the specific report today, would bring a more detailed focus on some of the key aspects of the work that Kate had outlined and some of the work that's been commenced over the last few weeks and months. Just to remind everybody that following the workshops that we held with our system partners at the end of the third wave, we refreshed our West Suffolk Alliance principles as outlined on this slide. They very much reflect the learning that we've taken from how we've worked differently throughout the pandemic, and very much reflect the collaborative working that's been very prominent throughout the pandemic and that we want to build on. The first one is very much a feeling about being brave and stopping the things that clearly are not adding value, and I think we saw that very much in our initial response to COVID, and really investing our efforts and energies into things that are working and working well. The second one is around ensuring we embed co-production principles in everything we do and do it properly, meaning that we take time to invest in those conversations and that joint working, not just with our partners, but with our local communities. The third one is about recognising our alliance is about a way of working, and our currency is the relationship we build with each other, and that everyone has a valuable contribution to make. The fourth one is about reflecting the wealth of the learning that I've just outlined from the COVID experience, and ensuring that we continue to be inspired by the goodwill and the energy and the can-do of our workforce and our local communities, and really build on the ambition that they've set for in our response to COVID. And the fourth one, which is close to all of our hearts, a big learning for us during the pandemic, is around the impact on and our reflection on inequalities, and ensure that that opportunities around reducing variation in access and equity for our local population is underpins everything that we do. We're pleased that West Suffolk Alliance was chosen by our ICS to participate in the second wave of the National Place Development Programme. Work has already commenced on this. This is a funded programme by NHSE, NHSI, and it's focusing very much on developing local place-based approach to improving population health improvement through a series of structured developmental modules focusing on a number of practical skills. The programme was launched on the 14th of March. Some of the colleagues on the call are involved in that, and will continue to run until the middle of July. The focus is very much on building on our population health management approach around elective care. We're really excited about our community discovery work that's falling out of the Wellbeing Forum that we established as part of our West Suffolk Alliance governance. The Wellbeing Forum is chaired by Ian Gallen and myself, focusing on a number of areas around how we engage in our local communities. This community discovery project is a piece of work aimed at better understanding the community activity, and is going to be used to build a longer term plan about how we work with our local communities to promote wellbeing in West Suffolk. It builds on the great work already in place, collating pen portraits of people's experience with lived experience, and also capturing all the good work and activity that's taking place. We've commissioned Rethink partners to lead this piece of work, and that will start at the beginning of April and run through to the end of June, and will follow a number of key lines of inquiries, which include impact of communities supporting our most vulnerable population. It will explore the potential to strengthen the role of integrating with our local communities alongside statutory services, and it will understand the provision and impact of community and activities through the CAS network and village hall and community buildings. It's a very important project for us, and we recognise that some of the work has already started through some of the work streams already in place, but this piece will absolutely bring it all together, and a full report of the outcomes of that will be available in June. Personalised care, I think you've had some presentations to governing body about this, a very important stream of work for us across our ICS. We're very fortunate in West Suffolk to have a dedicated project manager that's putting a specific focus on how we embed personalised care into everything we do. Pleased to say that the ICS-wide personalised care strategy is now approved, and there is an ICS-wide group established. In West Suffolk, we're planning a workshop on the 29th of March, bringing strategic and operational partners across the Alliance to map the current provision that's taken place and start to develop a shared vision locally of how it will support our ambitions of the Alliance. The opportunity to agree targeted priority pieces of work and work streams, including how we monitor progress, will be an outcome of that workshop. And we'll start to really reset the agenda and ensure that we embed it into our deliverables. You'll all be familiar with the great work that we've been doing with West Suffolk Council, in particular on community hubs. This has been a long-term strategy for West Suffolk, and I think we've been quite a leader locally around how we start to use our public estate to bring local communities and statutory services working closer together, supporting local populations. Great progress has been made from our pioneer site at Mildenhall, as you can see in the slide here, through the opportunities of co-location. And I think we've seen that in part at Sudbury Health Centre as well. But Mildenhall is really starting to show some evidence about the impact, about how the communities are engaging with the hub and the range of services, and starting to utilise the services that are available. Further work continues, of course, looking at our public estate generally and ensuring that we maximise the space that's available and utilise it to drive the integration of our services locally. You'll be aware that we have a Director of Community Health and Care in West Suffolk, Clement Mayowo, who's now been in post for almost a year. He's on secondment, and that current role is under evaluation. His priority is really to to drive the implementation of an integrated health and care operational structure in West Suffolk. And he has successfully embedded a structure that's now live and fully functioning. And we have integrated health and social care managers, adult social care managers in post, supporting not just the integrated neighbourhood teams, but the wider specialist services that cut across health and care. He's done a great job in engaging local staff, in informing that structure. And I think staff are feeling that they've got a supportive line, or got a supported operational structure in place. And that is key for us locally in West Suffolk to ensure that our health and care integration continues and flourishes. And Clement will now, I think he's going to be presenting to the next system executive group meeting on where he is. What's also key within that is the implementation of integrated neighbourhood teams. We're not starting from scratch. Great work has progressed there, and we'll have an update at the system executive group around where we are. What I'm pleased to say is that the maturity matrix that we developed locally as a self-assessment tool for the integrated neighbourhood teams around where they are in that scale of maturity has received some national recognition as a tool of excellence. And we've been invited to present to the Health and Social Care Network regionally on how it's moved the integrated neighbourhood teams forward and how it can be rolled out at scale. I'm also delighted to share with you that we at West Suffolk have been awarded £500,000 to which is not an insignificant sum of funding to test an integrated health and care remote monitoring solution, building on the Cassius technology used by adult social care. The project will shape a sustainable operating model for implementation after it's been tested. And we're working very much with Kate Walker's team, ICS level, and our colleagues in adult social care to ensure that this is absolutely joined up. What's key for me in this piece is the national requirement to set up virtual wards by autumn this year. The technology solutions around virtual wards will be absolutely embedded into this project to ensure that we get absolute integration and alignment. The next two slides focus on the new governance towards the Integrated Care Board launch. Key for us is the co-production piece and testing what works at place with our partners. And that's been a key part of my role since I've taken over from Kate, and how this interfaces really well with the ICB governance that's being established, and how we ensure that we are not duplicating and absolutely aligned. We've recently tweaked the structure, which I think many of you seen already before, through the following further engagement with system partners. The recent tweak that we've made is around bringing the Wellbeing Steering Group and the Health and Care Steering Group together as one. And I think that's a conscious move to ensure that we're aligned with our other two fellow alliances, but also importantly from feedback to ensure that we're not pulling the same people to too many meetings and starting to bring the agenda into one. What will be key, because it's a massive agenda, is that the infrastructure below this around the work streams is really clear and resourced. The next piece of work that I'm focusing on, which I've shared with you all before, is how we start to refresh our approach to locality development, and what that looks like in terms of groups, forums, engagement. And so I'm trying to do a sort of an engagement piece with system partners to work through how that may look. But clearly localities as part of our strategy locally is a very important part of our delivery mechanism for integration, and so getting the locality infrastructure right is key. Thank you, Chair.
Thank you very much. Does anybody have any questions for Sandy? Jeff?
Thanks, Christopher.
Hi, Sandy. Thanks for that update. I just wanted to check. I attend a Newmarket locality group, which has got a wide range of partners on, which is focused on well-being. Will Wright chairs it. I'm just wondering, I mean, it sounds to me as if that's doing some of the work that you're talking about community development, etc. I mean, we have the clinical director on from PCN and various other individuals. And we've done some stuff on no smoking, and we're doing stuff on fitness and what have you. I just wonder how that connects with the piece that you're talking about. That was all. Thank you.
Thanks, Jeff. I'm really pleased you raised that. So Will is brilliant, isn't he? So Will is very much it's all connected. Will's very much part of that community discovery and wellbeing piece. It's all interconnected. What we aim to do through the discovery piece is not duplicate any of the work that's already undergone, and Will has absolutely been part of the scoping of that piece of work. So it's all interconnected, and we'll probably link into that forum, the Newmarket group, with the focus on wellbeing, to draw in the intelligence that we need from that locality, and Rethink will lead that piece. So it's all interconnected, but thank you.
Okay, thank you.
Any other questions? I'll just take you back to your first slide, Sandy, where the first principle actually was to learn from what has not worked and build on what is strong. I just want to remind you that, well, I'm sure I don't need to remind you, but that the NHS does need to have quite a long memory. It does have a little bit of a history of recycling bad ideas just out of the living memory of the people who happened to be in post at the time. Now, I know you've been in post a long time. The GPs are absolute dinosaurs, but it is important not to go round dead circles again, because it wastes time and dents morale. It's a really important principle.
Thank you, Christopher. Totally agree with you.
Thank you for the presentation. Right, then we're on to the procurement update, which I am sure you will have all read in detail. As Ed pointed out at the beginning, we don't have Paul to tell us anything in addition about it. Sorry, do you want to say something about it, Ed?
Sandy's primed to present it.
Oh,
She's
okay.
stepped into the breach. Yeah.
Thank you, Sandy.
You're very welcome. Yes, no, Paul and I have met. Just that's why I was late. So my sincere apologies. I was just getting briefed by Paul. So I assume that everybody's got sight of the paper, and I take it that it's read. Paul's asked me to pull out 4 key messages to brief you on, please. One around the ICS-wide pathology procurement. The process is planned. The procurement process is planned to commence in April, as agreed through CCG governance. The mental health assurance process, this continues to progress, and it's been trailed and discussed at previous governing bodies, but it's been delayed, unfortunately, in past due to the COVID pandemic and also to CQC visits, but it's now picking up and continues. The mental health LD and autism framework, that's now completed and will be an item on the agenda of part 2 of the governing body. And the final 4th message from the paper to note, please, is the national provider selection regime is now out for consultation and is in progress, and it is due by the 25th of March. Thank you, Chair.
Any questions on that? Okay, thank you. In which case, we move on to financial planning, Jane.
Yes, thank you, Chair. So this paper is quite a process paper, but it's covering a number of different areas. So if I may, I'll take it in 2 parts. And first of all, to talk about the annual plan for 22-23. So I think we updated the governing body last time we met that things that guidance and allocations for the 22-23 financial year had started to come through, and we've been working on those over, well, alongside many other things, but we've been working on those as a planning group over the last couple of months. Unfortunately, the timetable just doesn't work for the governing bodies. So the draft plan that's mentioned in the paper was submitted by the system on the 17th of March, which was just slightly too late to include in the papers for this pack. But I can assure the governing body that the draft plan was indeed submitted, and that covered all the areas that you'd expect. So it's workforce, it's performance targets, it's the financial plan, and it has an accompanying narrative. And I'm pleased to say that a lot of the work has been done on those, but there's some challenges remain, both in terms of looking at the trajectories on achievement of targets and around the finances, which we spoke about last week at the Finance Committee. So the draft plan has gone in, and the final plan, unfortunately, is due to go in before we meet again as a governing body. So what I'm suggesting in the paper is that we use the committees we've already got in place, so the Financial Performance Committee for the finance and budget side, and the clinical exec to look at those in detail and do the formal sign off on behalf of the governing body, and then bring them back so that they can be seen in public when we meet in May. So if I pause at that point, Chair, before I move on to the other little bits and pieces, just to see if people are happy with that as a proposed approach.
Yeah, I think everybody happy. I've seen no reason to object. Thank you very much.
Thank you. And then the second part of the paper is really just a technical one. We have two things that we put in place during the COVID period that have been working quite successfully. That's the COVID Resource Allocation Committee, the CRAC committee that we use for to bring the 3 CCGs together to make decisions, particularly on COVID related resources. We meet very rarely now, but it is really helpful to have the oversight for things like the separate funding for the vaccination programme. So I'm proposing that we leave those in place, only to be used as and when required, but we leave those in place until the ICB brings all of the organisations together. And at the same time, I'm proposing that we keep the increased delegation levels, just in case. We use those very rarely, but it would seem appropriate just to continue those on to the new ICB, at which point all the levels will be reviewed for the new organisation.
Everybody happy? Yep, lovely. Thank you.
Thank you.
Any further on that? No? Okay, thank you very much. In that case, we go on to the integrated performance report. So we haven't got Richard and we haven't got Paul. So I think perhaps we better start with you, Lisa, please.
Yeah, no problem. And actually, although we haven't got Paul and Richard, a lot of the issues that we're seeing from a quality and outcomes and incident perspective is related, obviously, to what Paul would be saying. So I guess there's 3 overarching quality concerns that we currently have. The biggest one is relating to the demand and capacity issues that we have, we're seeing the consequence of delayed access through our emergency pathways, through primary care, through the ambulance trust, and you'll see on the charts at some of our performance around C1 and C3, which from the ambulance trust, which is not where we would want it to be, and then through into the acute sector. So we have, so that's probably the biggest quality concern that as a system we have. The second issue that we continue to have concerns about is access to dentistry, and you'll see from the Practice Plus group slide that one of the key reasons for contacting 111 continues to be dentistry, and you will be aware that we have a system group which involves Healthwatch and all partners from the regional team and our ICS to look at what we as a system, a Suffolk and North Essex system, can do to improve access to dentistry. And I'm sure we'll be bringing an updated paper when that piece of work has some outputs, and we'll bring that to you for an update. The third area that we have quality concerns around is the number of children and young people who are accessing the acute providers for in crisis and as a place of safety. So again, we have a system, task and finish group. We're really clear on the long-term and medium-term measures that we're doing to try and prevent children and young people requiring mental health support in crisis, but there are some short-term measures that we think we need to put in place. So looking at how can we support the workforce in our acute hospitals to be able to provide a better care and a better environment, and looking at anything else that we can do from a short term. So they're probably the three key quality issues. If I go to obviously COVID is also creating a number of issues for our providers, not just with patients but with their workforce. So at the moment, West Suffolk Hospital has around 60 inpatients with COVID and has 10 bays closed within the hospital due to outbreaks. So that's creating some real impact on the flow and access into inpatient care for West Suffolk Hospital. We have an outbreak in NSFT in the West, and also in some of our independent providers. They also have outbreaks, and we have 20 care homes and 11 supported housing facilities with outbreaks in the West. So you can see that the numbers have risen again of patients with COVID, and the impact that has on workforce. Now, what we're not really clear on from a number point of view, we think it's about 50% of people who have COVID in hospital who have it's been found through testing in hospital and actually are not symptomatic. We're not at the moment, and there's a piece of work we need to do to understand how many people are being admitted for COVID and how many people are being admitted for other reasons but have COVID. And we think the second category is far higher than the number of people being admitted for COVID. We're not seeing high numbers in our intensive care units, and it's not having the acute impact that it previously had, but it does create a number of issues for workforce, obviously, and for the management of emergency care, particularly. If we look at NSFT for the children and young people, it's really great in the eating disorder service that we're now meeting the urgent referral standards. But I think if Richard was here, he would say that eating disorders and the ability to meet the routine referral standard is still one of our key concerns. You'll see on the slides there's a lot of work that's being done to improve that position, but that continues to raise concerns with us. The emotional wellbeing hub, we've obviously talked about at length. It's great to see that they are now meeting the red and amber case timescales, which is great. The green caseload also trajectories are continuing to improve, but not in line with the planned trajectory that we had from the remedial action plan. As I said, Practice Plus group, the key symptom groups are around repeat prescriptions and dentistry. Repeat prescriptions, particularly over weekend and bank holidays. So there is some significant work happening around. We've obviously got 2 long bank holiday weekends coming soon over the next few months. And the ambulance service, I think, would be the other area that I would just want to highlight. And we're doing some work to understand system incidents involving all partners, where we think that actually harm has been caused to patients due to system delays in the emergency pathway. Thank you. I'll leave it there, but that was a whistle-stop tour. Thank you.
Thank you very much. Any questions for Lisa? Thank you. I guess we pounce on Sandy again for integration. Have you got anything to add to really what you did on the Alliance, Sandy?
Sorry, I've got a little tickle in my throat. I keep coughing, so I'll try and keep this. What I really am pleased to show.
Sandy, your microphone is up above your glasses, and that's so we can't really hear you or the cough. Thanks.
Oh, apologies. Okay. Yes, I think one of the good things I would like to share around progress in West Suffolk is around the Ageing Well agenda. This is a national programme. You would have received papers on this previously, which focuses on 3 key planks of work. One is around our response to urgent community crisis responses or calls. The other element is around enhanced health and care homes, and the third element is around anticipatory care. And I think it's fair to say that our focus, really driven by the pandemic, is around getting our urgent community response absolutely fully embedded into business as usual and integrated across the system, for which that's done really well. Anticipatory care has probably been the area that we've been least focusing on for obvious reasons. But we're pleased to say that we've also been given a bit of money from region this year to start to set up a test bed for anticipatory care, which is quite exciting. And we'll be the first in the region to do this. And this links really nicely into the place development programme work that I spoke about earlier, that's looking at population health management outcomes for elective care. So we're just in the scoping phase of that, but that clearly strengthens our approach to the Ageing Well agenda, and really starts to bring the 3 pieces of work that we need to deliver on into a more positive phase. So more to follow on that, but I'm really pleased to say that we've managed to successfully bid for that small pot of money, but it moves that agenda forward.
Thank you very much. Any questions for Sandy? Okay. Finance, Jane. Any developments? Most of the attendees here were at the Financial Performance Committee last week. Have there been any significant developments?
No, they haven't, Chair. So just for the minutes. Sorry, I've got an echo. Don't know whether that will go away. But just for the minutes, the presented in the pack is the month 11 position. So that is the position at the end of February. We are on track as a CCG to achieve our target, which is to break even for the financial year, following reimbursement from central resources for hospital discharge programme and the elective recovery programme. Because of the echo, I won't say much more, but as I said under the planning paper, we're working now on the 22-23 plan. We spoke about that at the Finance Committee last week, so I'm happy to take any questions, Chair.
Thank you. Does anybody have any questions? No? Okay, thank you very much. Well, I think that's probably as much as we can take of the integrated performance report, given the folk we've got around the table. So I'm proposing then to move on to the governing body assurance framework, Amanda.
Thank you very much, Chair. So here we have the latest assurance framework, and as you can see, all risks continue to be updated, but I just wanted to update the governing body on a lot of work that's happened around the cyber risk since we last met in light of events in Ukraine, and a lot of activity, a lot of comms that we've received from NHS England on making sure that basically we're doing everything we can to mitigate. So in terms of cyber then, what we have done over the last few weeks is to enhance communication out to our staff, reminding them and what to look out for if they receive any suspicious emails. We also have been doing ongoing work to patch systems, and whilst this is very much part of our business as usual, We have recently undertaken on the 14th of March a forced restart of machines, which basically enabled machines to have reinstalled the appropriate patches. So that was well received on the 14th of March. We continue to work with NEL as our IT provider, and they continue to monitor all things cyber as part of the ongoing contract. And in doing so, they obviously continue to make sure that we have the necessary checks, balances and backups in terms of restoration of mechanics to ensure that any kind of gremlins in the system are worked through to avoid any cyber going forward. So I think in a nutshell, a lot of work over the last few weeks on cyber. I think we are as assured as we best can in terms of what we've done, working alongside NEL to mitigate any future attacks. And then I just wanted to highlight a new risk this time on the assurance framework, and that's related to children and young peoples. And then behind the GBAF, we have our usual updated Directorate Risk Register, where all of those local risks have recently been updated by directors and indeed the Risk Forum. I'll pause there, Chair, but very happy to take any questions.
Thank you very much. Any questions for Amanda? Okay, thank you. In which case we move on to governance and corporate business. Jeff, would you like to take us through the minutes as listed in the agenda, please?
Yes, thank you, Chair. Yeah. Well, we've got committee minutes from the Audit Committee, Remuneration and HR Committee, clinical scrutiny, the COVID, the crack approvals, and the primary care commissioning and the collaborative. So I think, unless there's any questions to individual chairs, I would ask the committee to endorse those minutes, please.
Any questions? No. Okay, thank you. Right, okay. That takes us to item 13, the date and time of the next meeting, which is the 25th of May. Which under current expectations will be the penultimate meeting of this board. I look forward to seeing you then. We have questions from the public, which I will read out, and then we will, Ed will tell us how we're going to manage them. So this is from Councillor Margaret Marks, who has sent in 2 sets of questions, asking how much money the CCG was allocated from the government for the crisis management of dentistry in West Suffolk, how the money was used, how many people were treated or as a result of the funding, how the dental bus being used in Bury St Edmunds is being funded, and whether that bus could be used in other areas of the patch, and whether the CCG is lobbying for the necessary changes in the dental contracts prior to the handover in March 23, including an increase in the dental budget to match the expected demand. And then essentially, it's the same questions in a different format. I don't think I'll read the second set because I don't. It's a different format of the same issues, and the issues are the same. So, Ed, do you want to tell us how we feel we should respond to that?
Yeah, so they're all important questions and require some detail to answer them. As some of the detail sits with NHS England. So what I propose to do, Margaret, is get you written responses to each of those questions. And as Lisa said, we have set up a dental task force, and I'm sure the people leading the task force would also be happy to meet you if that would be helpful, Margaret, to have a bigger conversation around some of the issues that you've raised. Lisa.
Okay.
Thank you. One of the things that we've been talking about in the task force is how we can make sure that everybody that has concerns about dentistry is kept up to date with the work that we're doing, because there are a lot of people, including lobby groups and lots of people that are very interested in the dentistry access issues. So we are looking at, although we have Health Watch on the Task and Finish group, we are really keen to make sure that we have a good comms plan so that everybody's kept up to speed with what we're doing, because we do know and understand it's a significant concern for people.
Thank you. Right, and those written answers presumably will form part of the minutes of this meeting and be appended to them, yeah?
Yeah.
Okay, thank you very much. Right, that concludes the public part of the board meeting. I would propose a short break at this stage because the part 2 agenda is actually quite meaty, and we may be quite a bit of time on that. So may I